Good morning, and thank you very much for joining us. We're here on Treaty 6 territory, and I acknowledge the Métis people of Alberta, who also share a very deep connection with this land. I'm Sarah Hoffman, the Alberta NDP MLA for Edmonton Glenora, and our Shadow Minister for Health. I'm joined today by Wendy Weber, who has been waiting for a year for a double hip replacement. You'll hear from Wendy shortly. Albertans are suffering in extreme pain, and some are even dying while waiting for surgery, diagnostics, or treatment. A recent report by the public policy think tank, secondstreet.org, revealed that more than 15,000 Canadians died in 2023-24 alone before receiving surgery or diagnostic information. But there's a huge hole in that data. So the think tank believes that number could be higher, maybe double. What's the hole? Well, Danielle Smith and the UCP have stopped tracking or reporting that data for Alberta. We have seen heartbreaking stories of Albertans getting a cancer diagnosis and dying before they even get to see an oncologist. All Albertans deserve the right care in the right place at the right time, and that certainly isn't the reality for many Albertans today. So I'd now like to invite Wendy to join me at the podium and to share her story.
Thank you very much, Sarah. My name is Wendy Weber, and I need both of my hips replaced. About 6 years ago, I was told that my hips were basically bone on bone. But in order to get the necessary surgery to alleviate the pain, I would need to lose a bit of weight. Well, it took over 5 years, but finally the required 150 pounds was gone. When I went for the assessment, the assessor was very happy for me as I had seen him before. "Great job. Which hip do you want first?" he said. Right then and there, they booked me with a surgeon and arranged for me to have a class that prepares you for what's going to happen during the surgery and how to prepare yourself. He said it would be 2 to 6 months, the surgeon said it would be 2 to 6 months before I would get the surgery. 6 months later, I was a patient, it was September, and still there was no call from the clinic, so I reached out to them. I was informed that the clinic had been closed since July and wouldn't open again until October because they had no staff. No surgeries had been taken place during this time, so I was still 2 to 4 months away. I have been waiting, and still I haven't heard. I have no idea when my surgery will be done. I called the surgeon last week, and the voice message that was on their phone instructed anyone who is waiting for surgery to call Alberta Health Services and their MLA. I did both. My employer has been absolutely amazing through this and is allowing me to work from home because I can't walk. Going from my living room to my bathroom, the pain is so excruciating that it makes me want to throw up. My hips are so bad, My hips are so bad that I need help to put my legs into and out of my car. I can't go anywhere alone. I can't go anywhere without help. It's very restricting and isolating. I feel like I'm in jail. It was worse than during COVID, let me tell you. I used to have season tickets to the Mayfield Dinner Theatre. I used to go out on 2 big trips a year, and I used to be able to visit friends. I need help to do most anything. I try, and I avoid the agonizing pain because it hurts every single time I move. No one should have to live like this. I know I'm not the only one needing surgery. I am begging the provincial government to please help everyone who is waiting for surgery that will end their pain and give them back their life. Thank you very much.
Thanks, Wendy.
No problem.
You can stay here if you want.
Okay.
Yeah, I'll just stay beside you. I just wanted to add that CD Howe recently released a report that highlights the fact that Alberta's healthcare system, we used to be number one. In 2018, when Rachel Notley was a premier, I was our health minister, we were the top in the country, and now we're number 5. And it's a report that looks at things like health outcomes, the care process, and access to care. And access to care is where we fall in the most. We're number 7 in Canada. In 2018, we were the top again, and we can be there. We can be there once again if we actually put the priorities back in place. I want to say Danielle Smith spends a lot of time talking about the federal government staying out of her jurisdiction. Her jurisdiction is healthcare. Wendy deserves surgery. Everyone who's waiting in pain and wants their quality of life returned, and we know it can be returned if they have access to that high quality public health care, that's what Danielle Smith should be focused on right now. We're happy to take your questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9 to get into the question queue. We'll start with questions in the room. Please state your name and outlet and who you'd like to direct your question to.
Hi, Sean Amato with City News. For Sarah, so the Alberta government is working on this Alberta Surgical Initiative.
Right.
Is that working? They're saying that in some cases wait times are coming down.
Wendy, is it working for you?
It's not working for me. I mean, seriously, it took me 5 years to lose the weight, and I really thought that I would get surgery right away. I've been in pain for that full 5 years. I know I wasn't on the surgery list for those 5 years, but I was connected with the assessor who kept telling me, you're doing good, keep going, you're doing good, keep going. When I got to the goal, I thought I would be going in, having the chat with the surgeon, saying, okay, your surgery's going to be, I didn't expect it in a week, I'm not that much. But when they said 2 to 6 months, I really believed that that is the answer that I would have. So 2 to 6 months, when I called and they said that they had closed the facility that I was going to have my surgery in because I had no staff, nobody called me, nobody phoned me, and the answer that they gave me was, well, it was on the news. I lost it. I said, I didn't think Albertans had to go to the news for their health care.
Yeah.
I was really angry. I think I called everyone. I called Sarah, I called the minister's office, I called AHS, I called my surgeon, I called my family doctor. I said, I can't believe this. They didn't even tell me. So now I'm still 2 to 6 months away. After being 2 to 6 months away, I was livid. I was livid.
Well, and I'll just add that there are moving staff out of hospitals like the Royal Alex and other public hospitals where we've already paid for the operating rooms and we've had staff previously into private surgical centers. We're really short on anesthetists as well as nurses that support specifically in surgery. And a lot of those folks are moving into the private new facilities, but that means that there's a huge gap in the public facilities. Those facilities aren't, as Wendy said, hers isn't even operating at all right now. It could be operating at the old hours, but it should be operating actually at expanded hours. Why we aren't using our public resources is an ideological decision, and Danielle Smith is causing pain for so many Albertans that really deserve a premier who's got their back and will focus on giving them back a good quality of life and letting Wendy go back to work.
Yeah, Sarah, I wanted to ask you, where does the NDP stand on using public facilities versus using privately operated facilities? Does the NDP really care, or is the goal here just to get as many surgeries done on time and done well?
I think most taxpayers would like to know that the things they've already paid for are being used and used to their fullest capacity. So my goal, and when when I was the health minister, was we tried to ramp up surgeries as much as possible in those public facilities, and we didn't close any of the private ones that had opened, but we really should be maximizing the resources, the staff, the expertise that we have in public first. I'm an unapologetic social democrat, follower of Tommy Douglas. It's what brought me to this party and to a life of service in pursuit of great public health care and education for all Albertans. Making sure that we have those resources in place so that everyone can get them, folks who've been waiting and working towards their goals and alleviating their pain as quickly as possible. So public first, and they definitely are undermining the public system while staff are leaving to go work in these private facilities.
Catherine Kirkowski, Alberta Today. So in the 2019 election campaign, the UCP agreed that waitlists for surgery were a big problem. So where do you think the UCP's actions have gone wrong?
In 2019, in
Since
2023, like
2019.
over and over again, they keep saying, acknowledging that people are in pain, that people are dying, that people are waiting, and that it's wrong, but they're doing nothing to make it better. In fact, they're making it worse. So when we used to be #1 in the country, now we're #5. I think it's really clear that they care more about their friendship with the United States and implementing US-style politics and policies here in Alberta, moving away from a single-payer universal public system towards more private delivery and making excuses. You might recall in the fall we brought forward a clinic that's opening in Fort McMurray that's also proposing private surgical facilities. And it not only has general support from government, it had letters of support from a cabinet minister, a parliamentary secretary, and a local MLA. So, they know what they need to say during an election to pretend that they care about the public and public health care, but their actions are definitely the opposite.
And you mentioned some of these, but what are some of the factors that are leading to these closures or shortage of hours, shortage of anesthetists, what are the factors leading to where we are now?
Yeah, well, there are a number, so I'll list a few of them, but definitely the disrespect that's being shown towards healthcare professionals in general. We saw just yesterday, or over the weekend, it was highlighted that the government gave $2 million for a conspiracy theory report that they're peddling that isn't science-based, it's not evidence-based. They have chased many doctors out of the province because they felt disrespected and that they could get better work conditions in other provinces. So that's been a factor. But another big one is that they've really been pushing these private surgical centers that see lower acuity patients, people who have multiple challenges won't be prioritized in them because they want volume, they want fast, easy surgeries in and out. And a lot of people have left working for Alberta Health Services or the public provider to go work in these private centers, and that is an issue. But also we haven't been attracting doctors like we used to. We haven't been attracting nurses like we used to, and for good reason. I was just with nurses on the weekend outside of the Edmonton General Hospital, the long-term care center. They're really frustrated about their work conditions and the lack of respect. There was a contract brought forward for consideration, and they rejected that contract because it's not going to help them pay their bills or meet the needs for their patients. And I think it's time the government focused on their jurisdiction. Healthcare is should be one of the top priorities for any provincial government. It is a huge responsibility, and when you need healthcare, nothing matters more.
Hi, Morgan with Global. I'm just wondering, I'm also going to go back to the past like Kat did. I'm wondering to what extent you think this is a backlog problem. Like I know COVID, we canceled a lot of non-urgent surgeries and things like that. Do you think there also is this just lots of surgeries got put on hold and now we're seeing the ramifications of it?
That operating room was open and now it's closed. It hasn't been closed for years. It was closed in the summer, and it's causing a big issue for patients who need access to those surgeries. So I'm sure the government will try to say, oh, don't worry, it's COVID. Every other jurisdiction in Canada also dealt with COVID, but we fell from 1st to 5th. 7th in access. So they're also figuring out how to respond to it. We're just doing a way worse job in Alberta under Danielle Smith and the UCP.
And talking about wait times, seeking emergency care, lots of folks have long wait times at the hospital as well. We're hearing in Lethbridge that there are folks who were being put in like a storage room to get their care there. Where do you think improvements could be made to reduce wait times for people seeking emergency care?
I read about that. I believe it was a cancer patient too. And I will say one of the things I'm proudest of that we did when we were in government is build the Calgary Cancer Centre, a replacement for folks in Calgary and Southern Alberta. They have added 0 new beds in Calgary for cancer patients. Even though we have this hospital that's, I believe, 7 times the size of the old facility, they haven't actually staffed it up properly to make sure that people can get the care. I'm not saying you should travel from Lethbridge to Calgary, but this is one specific example of where we've built capacity for the government to fund and staff properly so that people can get the care they need, that the current government's just doesn't care. They don't care, or they care more about their budget than they do about alleviating people's pain, letting them live with dignity, ensuring that you can have those things that give you a good quality of life back in your life by getting the care and treatment you need. And to be left in what that patient described as a storage area was not dignified. And I really feel for them. And when I read about that last night, I was thinking about him, I was thinking about Wendy and everyone else who's at home just waiting for diagnostic information, waiting for a surgery date, waiting for a family doctor. We have almost 1 million Albertans without a family doctor. This is a serious crisis, and it's time for the UCP to take it seriously and actually put the resources into the front line so that they can do their jobs and clear the backlog.
Thank you. We'll now to callers online, and Janet, your line should be open. Janet, are you there? We're ready for you. Maybe we'll just switch over to Morgan Smith. Oh, Janet, are you there?
Hello, I am here. Can you hear me?
We can now. Yeah.
Yay! I just wanted to say, my questions are gonna be a little bit broader, but I just want to say I'm sorry to Wendy for her experience. For Sarah, how do you know the government stopped tracking wait times? Specifically, what have they stopped tracking?
Oh, the CD Howe report speaks to it. They aren't the only province. Quebec and Newfoundland also did. But this is new for Alberta. We used to do it. We used to track it and report it. And we'll be able to flip that report to you specifically, Janet. But yeah, it was mentioned in the report that the 15,000 across Canada is definitely a lowball number, given the fact that Alberta and a couple of other provinces have stopped reporting or either have never reported. So it's a number that you might even recall the annual reports used to have so many measures, so many benchmarks, and we were pretty open and transparent. And it didn't start under the NDP, it had happened under previous Conservative governments. But this particular government has become extra secretive. And you I'm sure recall that they stopped tracking things like class size information. Now they're not even telling you how many patients in Alberta died before they were able to get some kind of treatment. So it's intentional. They think that if they don't report it, they won't have to defend it. But patients know the reality. Wendy knows the reality. And it shouldn't be like this. She should have her surgery and be able to get on with her life.
Sorry, I need to go way off topic and ask you about AIMCO. They have apparently let 19 employees go last week, including the person responsible for diversity, equity, and inclusion in that organization. What goes through your mind when you hear this?
It feels like we're moving backwards as a society, and specifically organizations that get government funding or are under a government mandate. I want to make sure that we live in an Alberta where everyone's pension is secure. I think more people would like AIMCO to focus on ensuring a high yield for their savings. More public sector workers would like to have co-management of their pension returned to them again, so that they get to have a say in how their pension is invested. And I think that this, I don't want to say it's a reaction to Trump, because I think it's so much deeper than that. And I think for Danielle Smith, it makes me really disappointed. I will say that. And I have a lot of young people in my life who look to their government, to the decision makers, to create a world that's better than the one that we inherited from the generation before us. And it feels like this is a move in the wrong direction.
Thanks, Janet. We'll go to our next caller. Please state your name and outlet and who you'd like to direct your question to.
You guys got me?
Now we can.
Perfect. Yeah. Hey, it's Tim with CTV. I guess a couple questions for you, Sarah. The first one being, so what are you accusing the government here of just removing benchmarks? I guess broadly speaking, about surgery reporting times, or are you just specifically worried about this one report that lacks maybe what could just be a press secretary ignoring an email regarding people who have died while waiting for surgery?
Thanks for the question. What I want to focus on is the fact that there are so many Albertans, just like Wendy. She happened to reach out to my office last week, the same time the report came out, and we were able to have a conversation, and she was willing to be brave enough to come here today and tell you her story. Not every Albertan is comfortable doing that. Not every Albertan will pick up the phone and call their MLA when they're mad about something happening in the healthcare system. There are thousands, probably tens of thousands of people who are suffering in a similar fate to that of Wendy. So I am here today to say that it's wrong and that it doesn't need to be this way. That the government should be open and transparent. They should tell people where they're at today, because we're starting to figure it out anyway. They should make sure that they're reporting publicly on what's happening, because when you report on something publicly, it says that you prioritize it and they're going to work to make it better, or that you're proud of where it is today. It's like sending your child to school and never getting a report card. You wouldn't tolerate that. You need to know and have those check-ins to make sure that we're on the right track. So what we're highlighting today is that this human story of Wendy's is something that is unacceptable and that so many others are experiencing, and that the government clearly doesn't care because they're not even keeping track of the data or sharing it anymore.
You have a follow-up?
Yeah, thank you. I guess my second question is another kind of broad one. You poked at it a couple times here, but I just want to know specifically, can you kind of tell us what the government needs to do to turn this ship around? I understand there was a lot of problems during the pandemic with backlogs, but are you essentially just accusing them of being cheap when it comes to staffing and spaces, or is there other things that the province can do to reduce this backlog?
Well, their ideology has meant that they've moved forward at record speed in setting up these private surgical centers. And what's happening is that a lot of the staff that used to work in hospitals, like the one where Wendy's supposed to get her surgery, aren't there anymore. So there's two pieces here that are a problem. Number one, we're not using the resources that we've already invested in. They're paying to build new surgical centers when we have hospitals already with operating rooms that should be operating at their full capacity to make sure that we serve the needs of the folks who are there today. And this operating room didn't close because of COVID, it closed because of the government. So making sure that we focus on using those public assets to the best of their capacity, and that we're focused on making sure that everyone gets the right care in the right place, that we're living up to our principles under the Canada Health Act. The UCP has said that they respect the Canada Health Act, but definitely access has been significantly impacted, and people like Wendy are waiting in pain as a result of it.
Thank you. We'll go to our next caller, Morgan. Your line should be open. Give it a go, Morgan. We should be able to hear you.
I thought I did, but I don't.
Oh, we can always get back. Morgan, sorry we can't hear you. Perhaps we can get back to you if you are having difficulties. Anyway, we'll just do one more quick pass for questions in the room. The kids are all right? Okay. Okay, well, we'll reach back to Morgan. Sorry we have that problem. And thank you all for coming today.
And thank you, Wendy, for your courage. Yeah.
No problem. Can I just add one thing? You guys see me sitting in the scooter? It won't fit in my house. I can get it to the door, but that's why it hurts when I walk from my living room to my bathroom or anywhere else, is because pretty though it is, it won't fit in my house.
So you use a walker?
I have to use a walker, yeah.